Hi guys, so today I'm going to be talking about Erb's paralysis and Klumpke's paralysis. So if this is your first time on my channel, my name is Mary Rose. I'm a medical student and my aim is to simplify as many topics as I can for my fellow medical students and also share my journey along the way and also share with you guys my story and my journey along the way. So let's move on to what we have for today. So when it comes to Duchenne's paralysis, we have six outlines for it. We have the introduction, we have the site of injury, we have the no, I can't forget this. We have the introduction, we have the site of injury, we have the nerve roots involved, we have the muscle affected, we have the deformity, we have disability, and yes, I forgot one. We have the causes of the hip paralysis itself. So we are going to start from the first, the introduction. That's basically what is Erb's paralysis. So Erb's paralysis is a nerve injury that happens to the upper trunk of the brachial plexus. And after the Erb's paralysis, then we have site of injury. Then it occurs at a place called Erb point where six nerves meet on the at the brachial plexus, actually at a place called Erb's point where six nerves meet, and those six names that meet are the C5, CC, C5, C6, nerve to subclavius, suprascapular nerve, and anterior division of the upper trunk and posterior division of the upper trunk. And then after the site of injury, we have the nerve roots involved, and the nerve roots involved are the C5 and the C6. And because the C5 and the C6 nerve roots are involved, it affects the branches and the divisions that comes from the upper trunk only. And after that, we have the disability that comes with it. I mean, what are those things that the person cannot do because of the as a result of Erb's paralysis? So number one, there will be no flexion of the forearm and the wrist. And number two, the person cannot supinate his forearm. This is called supination. This anterior part, this is supination. There will be loss of supination of the forearm, and also there will be loss of adduction of the arm. That's this the arm, this the arm. So the person cannot adduct. There will be loss of adduction of the arm. This adduction, person cannot adduct the arm. Then after that, we'll talk about the deformity. Is going to be extended and then pronated. Kind of, it's going to be something like this, something like this. So there'll be the arm is going to be extended and pronated. Arm is also adducted because since the person cannot abduct, then the arm is just going to remain adducted. Yes, I just remember that. And then when it comes to the causes, that's where some people get it wrong. Actually, the main cause of the Erb paralysis is undue separation of the head from the shoulder. And then the main causes of his undue separation of the head from the shoulder are which can occur during childbirth or trauma, like due to fall from a height or something. And that's it for Erb's paralysis. If you have any question regarding it, you can drop in the comment section and I'll do well to answer you. And after that, we'll move over to the Klumpke's paralysis. So yes, we head over to the Klumpke's paralysis. So Klumpke's paralysis is a lower trunk nerve injury of the brachial plexus, and the site of formation is that it occurs at the lower trunk. And the causes of Klumpke's paralysis can be over abduction of the shoulder or undue abduction of the shoulder. Yes, over abduction of the shoulder or undue abduction of the shoulder. And then the nerve roots involved are the C8 partly, and the main, and it also affects, like, the T1 is mainly involved while the C8 is partly involved. And the muscles affected are the flexor carpi ulnaris and the intrinsic muscles of the hand. Then we have the deformity. Then deformity, we have loss of movement of the hand due to injury to the nerve supplying the intrinsic muscles of the hand. And then we also have loss of flexion of the forearm due to paralysis of the flexor carpi ulnaris. The flexor carpi ulnaris is a muscle that is found in the anterior compartment of the forearm. Then after that, we also have the disabilities. Then disabilities, we have analgesia, we have ulnar syndromes, we have ptosis, which is drooping of the eyelid, we have meiosis, and the rest of them. Plus, you can also make your research, and also learn from your textbooks and your lecturers, and then add more to your knowledge or to whatever you're going to write in exam. And if you enjoyed this video and you know anyone that this video is going to be of help to, don't hesitate to share this video to the person. And before you share, don't forget to subscribe, like, and comment on any questions or any other aspect of the upper limb or lower limb you would like me to talk about. Thanks.